Um, and the well, at the top level, yeah, we're going to see a bill emerge from the Senate here in the next several weeks, and it doesn't have an official title in that. And so what often happens is it gets the names of the principal sponsors, and usually it's sort of in their pecking order. There's a lot of politics in it, but right now it's called the Booker Wyden Schumer bill. And what this bill is going to do is be what in for all intents and purposes is it's the big marijuana legalization bill that would do several very specific things at the federal level. And so the most basic description of it is that it would remove cannabis and its constituents from the Controlled Substances Act, and it would create a regulatory system for how the federal government's going to treat it as a product. And so those are the two main pieces.
Right.
That's the stuff that really is kind of where we're at now. And so that and the devil's in the details, all those things, everything I wrap off has got its own baggage and discussions and stuff. So, but that's taking a step back, there've been a lot of efforts in DC to try to figure out what can be done to alleviate all the weirdness that happens when you have states that are allowing cannabis related activity and the federal government doesn't. And so there have been different attempts at this, and these have had a mixed bag of results over the years. They've all been operating in an environment in which cannabis is very much a central player in the Controlled Substances Act, which passed in 71 and really sort of created a whole comprehensive system for how they treat the dirty drugs that could potentially be an issue, that are or could potentially be an issue for abuse. Cannabis was built in, and it was built in an incredibly complicated way, so that ever taking it out is brain surgery. I mean, stakeholders are going to be the states that have now an interest in the success of their own programs, the businesses, the licensees that are operating in those states that, they see the huge advantages, if they could start to sell products into other states that allow these types of products, that's good for them. The law firms and the accounting firms and the folks that make packaging and labeling, and I would expect there will be some in law enforcement that say, you know what, this is actually going to solve a lot of problems. There'll be others in law enforcement that say, this is a problem. We're not going to get the funding we thought we were getting. So the stakeholders will come out, but they're probably not going to be ones we haven't heard of before. Right. So even Republicans can understand why let's deschedule and let's create the framework that enables the states to do things like do the testing standards. This is a really good example of what the downside is without the federal government's involvement, is the vaping crisis that occurred just before COVID. We had a lot of people using vapes and dying. And it took a while to figure out what was going on. And the issue was that additives that go into those vape cartridges were harmful when heated. And nobody knew this because it's the kind of thing the federal government tests for. States don't have the ability to look into that at that level. And so it just went right on by. And so we're aware of these kinds of problems. And that's when Booker Schumer Wyden comes out and it's going to be this thick, it's going to be because of all of the things that they're trying to capture now that we're seeing because of the problems that have occurred due to this sort of bifurcated system. I hope that at that point it'll seem crazy that we were ever arresting people for possession of cannabis. And I think that it'll also seem pretty crazy that we actually weren't regulating what people were already doing with it. I mean, to think now that somebody can just buy cannabis from somebody that just can't say anything about what's in it, where it came from, how it was grown, that we couldn't even tell how potent it is, much less anything else. There are over 100 cannabinoids in these plants. We don't know but about 4 of them. And in 5 years, that's going to seem primitive. If you look at how sophisticated the markets are in some of the states that have legalized, like Colorado and some of these others, it's shocking, I think, to a lot of folks in Montana who just haven't had a chance to see any of this stuff. After we federally legalize and there's research happening at federal agencies like never before and at private companies like never before, it's going to be a completely different landscape. Find out. But my guess is going to be that there's an agency called TTB. Don't ask me what TTB stands for. Nobody knows. And so ATF now is hardcore, bust down your door cops. The administrative aspects of managing licensing and the alcohol industry now lives in TTB. And I suspect that that's probably where cannabis regulation would come from as well, because there's a lot of similarities between the kinds of challenges, where you have people producing it and transporting it and selling it. And it's really kind of a controlled substance all along the way, and, taxes and all the rest. Very familiar territory for the federal government there. But there's also going to be the FDA, and their charge is making sure that people that consume things aren't putting, dangerous things in their bodies. And their original charter really makes sense. They really were born from, the era when people were really buying very dangerous products from snake oil salesmen, like the literal ones, is what the FDA was trying to say. Okay, if you're out there selling stuff that people put in their mouths, you have to have some safe things to say about it. And so what the FDA is going to be concerned with is probably just making sure that if you're not making, first of all, harmful products, but then secondly, you're not making claims that aren't true or aren't backed up. Standardization is going to be one of the big things that's going to come from the federal government. That's going to be driven both by the FDA and by the taxes, because how do you tax a brownie that's infused with cannabis? That all that stuff has to be sorted out, and the states, kind of have a system. But another problem that we're going to run into is, how do you harmonize all the state tax systems? And if you're selling products in a high tax state, how do you compete when now somebody's going to come into your state? Maybe they don't pay those taxes on the production in their own home state. So all that stuff has to be sorted. Personal for me, I don't know if you know my history at all. I was a criminal defense attorney in Montana and ended up with Crohn's disease, and also had some clients who were medical cannabis patients, and I didn't even know about the program. I got really, really sick. While I was in the hospital, the doctor told me that once I recovered, I should probably be a medical cannabis patient, which then I tried to do, and he wouldn't sign my forms because he was afraid the DEA would come after his license. And so that sort of set me off on my journey. I started lobbying the legislature in Montana to improve a very a law that was well-intentioned but needed a lot of attention. And our state government wasn't willing to go in and do anything about it. And so it's really kind of was the beginning of my advocacy work. While I was doing that work in Montana, I met a bunch of folks who we became friends and thought, what, we could start a business and probably do very well just using real kind of basic business sense and a sense of what the law is and how we could work this. And we did start a business called Montana Cannabis. I was in it for about a year and left to go kind of start a private law practice, working with businesses and individuals around the state. About a year and a half later, the DEA came in and raided about 28 businesses in Montana, all in about one afternoon, including the business that I started, Montana Cannabis. And so because of criminal conspiracy laws in the federal system, I was brought up on charges, told that if I didn't plead out, I would get a mandatory minimum of 87 years. For all of the charges that I was up on at that point. And I think the maximum came in at over 500 years, something ridiculous. Then they threatened to go after my wife, who helped in the office. She was helping, do appointments and stuff. So they were going to throw us both in prison. And they did prosecute one of my partners. He was being transported to a medical facility when he died in prison. Another partner refused to take a plea agreement and got a 5-year sentence. And then I did take a plea agreement and was ultimately put on probation. So that ended my law practice, and I ended up working for Marijuana Policy Project for the last 8 years. During that time, I helped Illinois pass its legalization law, which was the first state to do that through its legislature. So I was very proud to have done that. And that really then led to the work that I'm doing now in DC and working at the federal level on behalf of the Marijuana Policy Project as Congress starts to really change its laws at that level. So for me, seeing a bill like Booker Schumer Wyden around the corner, being able to represent individuals and businesses all across the country, and really try to untangle the incredibly complicated knot that was tied around marijuana so that we can come up with a much better approach. That is, it's really a gift beyond measure for me. I can't imagine a greater honor than to take apart this system that's put countless people in jail and in trouble for something most people really think just ought to be treated like alcohol. So